Parallel to the deterioration of our lifestyle, important but little discussed aspects of it are also deteriorating, such as libido. And what is libido? Well, libido is simply sexual desire. That's it. Although it's not always a problem to have a low libido or lower than what you think is appropriate. For many people, this poses a problem, and a problem that greatly reduces their quality of life or can trigger frictions or relationship problems. In fact, it does often, especially when there is a disparity between your partner's libido and yours. There is even a diagnosis for this problem called hypoactive sexual desire disorder, and it is a common problem, although difficult to measure, as it is something totally subjective. And also, on the other hand, it is a taboo subject for many people who keep it a secret out of embarrassment. Normally, approximately 35% of women suffer from low libido, and it is much more common, as you can imagine, in the menopause years. In men, the problem also exists, of course, although to a lesser extent, with estimates of between 3 to 15% of men who also suffer from low libido problems. And now we are going to look at the causes or the main causes of low libido. Because lack of sexual desire is a problem with different causes that also interact with each other. First of all, we have psychological causes, which are very important. Stress, anxiety are the two most common causes of having low libido. When we are anxious, when we are worried, when we are stressed, the hypothalamus pituitary adrenal axis is activated, which is the axis that allows us to fight off a threat. Activate the fight or flight response. Well, this axis is overactivated and inhibits the gonadal axis, making us not want to do anything and also not want to have relationships. Therefore, first stress, anxiety, but then we also have mood disorders. Specifically, depression is one of the main causes of low libido. Some treatments for depression, some antidepressants themselves can also decrease libido. And there is also another element related to these previous ones that I have mentioned, which is insomnia, which is also a very frequent cause of low libido. But let's not just stay with psychological causes, because we also have physiological causes that are equally important. First, we have metabolic problems. Our metabolism is closely related to our sexual health. And people who are overweight, obese, have type 2 diabetes or insulin resistance, have less desire and more risk of problems like erectile dysfunction. Another major problem is that metabolic problems deteriorate the cardiovascular tree, which leads us to the second part of the metabolic causes, cardiovascular disorders, cardiovascular problems. The health of your cardiovascular system is key. Since when our blood vessels, and specifically the inner lining of them that we call vascular endothelium, well, it's damaged. They can't carry enough blood to the genitals, causing erectile dysfunction and other associated problems. In fact, there is a molecule that is key in today's video and that produces what is known as vasodilation, that is, dilating the blood vessels so that more blood can pass through them. Indeed, it's nitric oxide and it's very important. In fact, we talk about nitric oxide at length in the nitrate video that I recommend you review. Viagra is a well-known drug that really the name of the active principle is sildenafil. It acts through this pathway. It acts by increasing nitric oxide and facilitating the vasodilation of blood vessels, improving erectile dysfunction. Therefore, there is an enzyme that synthesizes nitric oxide, which is nitric oxide synthase, nitric oxide without rate, and this is enhanced with two elements. On one hand, I just mentioned nitrates, which we find in vegetables above all, although we can supplement. And on the other hand, arginine, an amino acid. Inorganic nitrates and arginine, an amino acid that we also find in some foods. And thirdly, among the physiological causes, hormonal problems, hormones, sexual hormones, estrogens and testosterone, mainly because they are the production of nitric oxide in the genitals. So if there is a problem, whatever it is that acutely decreases estrogens or decreases testosterone, no supplement, no food is going to help you. What you will have to do is solve that hormonal problem. Metabolic problems are a frequent cause of decreased sex hormones. Therefore, these two elements are very closely related. But there are also other diseases that will have to be first diagnosed and then correctly treated. That may be causing a hormonal deterioration and therefore be a cause. Pathophysiological of erectile dysfunction or low. Libido. This problem, the one of low libido, is a problem, as I say, very multifactorial. And there's another aspect that is usually completely overlooked. Doctors, the first ones, which are the social causes. Social causes are as or more important than psychological and physiological ones. They are probably the most difficult to recognize and solve. And they have to do with relationship problems. They have to do with social pressure to have relationships. They have to do with differences in the amount of libido that each person naturally has. Because in this topic, each person is a world and each person is different. But well, we have seen the causes and we have seen them very superficially. As I said, this could be greatly expanded and we could make many videos, but let's see now, well, what can help me, right? What do I have to do? What solutions are there? First, the first thing I would tell you, and really is the most important, solve the root problem. The initial problem is what you have to look for and solve. First, ask for help from a professional. The professional could be a psychologist, sexologist, psychiatrist, endocrinologist, or urologist. But in any case, there are different professionals who can help you with this issue because hiding the problem is not going to solve it. As I mentioned, this topic is taboo when it shouldn't be, since we're in the 21st century. It makes no sense to hide these issues. As mentioned earlier, it's an extremely common problem. Afterwards. Lifestyle habits. Watch, monitor, analyze, and improve your habits. Among all that we can say about lifestyle habits. If I had to summarize all the causes I've told you before and stick with just one, the most important one, the one I consider most important would be stress. Reducing stress. If we start from high levels of stress, your libido is sure to improve. There are lifestyle changes that, in addition to stress, managing it, are especially important, such as quitting smoking. Tobacco is super harmful to blood vessels in general and is going to be a major cause of erectile dysfunction. Quitting alcohol, which also has a negative effect on sexual hormones, losing weight, or starting to exercise. In this regard, aerobic exercise with moderate or high intensity is especially interesting. Once you have improved this, because these 2 points are essential, once you have improved this, there are some useful supplements, even foods. Useful. Thirdly, let's talk about maca. What is maca? I've mentioned it in some videos. Maca is an adaptogen, like another supplement that is ashwagandha, which we have also discussed and talked about. What adaptogens do is reduce the negative effects of stress on your body. Maca increases libido in the first 8 weeks of supplementation and then stabilizes that libido. Libido rises in the initial 8 weeks, then levels off. It makes a dish, it makes a plateau, it stabilizes, it is also effective, and this must be taken into account in the years after menopause. And in fact, it's probably when it makes the most sense to help you with some of these supplements we're going to mention. Hammocks not only boost libido, but can also help with sexual dysfunction caused by certain antidepressants. As I said before, there are drugs, like some antidepressants, that cause a decrease in libido or erectile dysfunction. And how to take it? Well, we take 2 to 3 grams in the morning with breakfast. Maca extract comes in various supplements and is generally easy to find. 4. Arginine. Arginine is an amino acid that we could call conditionally essential, but it is also a widely marketed supplement. Arginine is interesting because it promotes nitric oxide. Arginine first turns into L-citrulline, and this increases the production of nitric oxide. It has a mild but beneficial effect in the studies that have been done with arginine in erectile dysfunction and in libido. And how would we take it? Well, we would take the most usual dose, which is 5,000 milligrams or 5 grams once a day, with or without food. It's irrelevant. However, be careful, as side effects such as headaches or itching may occur, which can be minimized by dividing the dose into 2 or even 3. Fifthly, we would have citrulline, which precisely We just mentioned it right now. Citrulline is another amino acid that is involved in the synthesis of nitric oxide. It boosts nitric oxide levels in the body. In addition, citrulline has the ability to convert into arginine and arginine into citrulline, depending on the body's demand at a given time. And this is primarily the reason why it improves libido or sexual desire. There are foods with significant amounts of citrulline, but the most notable is probably watermelon. Watermelon juice is a very good option as long as you drink at least half a liter. Taking less, the amounts of citrulline you're going to take are insignificant, and let's not forget the effects of citrulline improving athletic performance. In 6th place we have cocoa. Cocoa is truly a wonder. Cocoa is a gem of nature and it's loaded with very important phytonutrients which are called flavonoids. Cocoa improves erectile dysfunction, increasing the amount and also the availability of nitric oxide. But what's the effective dose? Because to see any result, not everything goes. If you buy a chocolate with 30% cocoa, like most, you're not going to see any result. You will have to take at least 1 gram of cocoa polyphenols daily to see any result, which translates to pay attention at least. 30 grams of pure cocoa powder from pure cocoa powder extract, which you can find in most supermarkets. The pure cocoa powder without added sugars can be found, it's easy to find. Or 40 grams of dark chocolate, but at least with a 75% or more cocoa concentration. A chocolate with a 50-55% won't do. Try to make it at least 75-80% cocoa. And finally, 7th tip, fenugreek supplement. Fenugreek is a root normally used in Ayurvedic medicine for a very long time. For what? Well, to increase vigor, to increase strength, to increase testosterone, but also to increase libido. As a curious fact, the fenugreek root causes body fluids, saliva, sweat, urine to smell like maple syrup. Be careful if you supplement with fenugreek and also take anticoagulants, as fenugreek contains coumarin, which is a natural anticoagulant that can interact with these drugs. So watch out for this point. The most commonly used patent is called testofen, and a dose of 500-600 milligrams is usually taken daily.